best.
It is the WAVE 97.9 WHAV, and in the studio with us is Diana Richardson, and Diana is the interim president and CEO of what once was called Lawrence General Hospital. But Diana, good morning to you.
Good morning, Wynn. Thanks for having me here this morning.
Oh, it's my pleasure to have you here. And so now, I remember when we ran the story about the name change, and you were joking about this will be the last time and all that stuff. How's it going, the name change for the hospitals?
So we are 1 week in of what will be a long journey, but I would say there's a lot of excitement from our clinical teams and within our organization, a lot of excitement in our kind of public elected officials who support us, but most importantly, a lot of support from the community. I'm just really enthusiastic about the fact we are recommitting to community-based care here in the Eastern Merrimack Valley.
All right, so people have the name changed down.
That would be no. I think it'll take a long time before we don't make some slip-ups when we're referring to our names. That's both internally and externally, but we're going to keep trying to talk about Merrimack Health Lawrence Hospital, Merrimack Health Methuen Hospital, and Merrimack Health Haverhill Hospital.
Oh, yeah, and a lot of folks, especially in WHAV land, they're keeping an eye on what's happening in Haverhill, and why don't you give us an update on that?
Yeah, so we had announced some changes back in May that will be happening over the next couple of weeks. Some of those changes, although they made big news, they're not really changes for a lot of patients. So, for example, we won't have inpatient medical patients in the building anymore. So if you come in for services for inpatient care, you would be at Methuen or at Lawrence. But that's actually just a teeny number of our patients. Most patients that come to Haverhill Hospital come for the emergency facility, and that will not be changing. The licensure changes just because of the building, but the actual services are the same. You have an ambulance that needs to get you care in Haverhill, you come to our emergency room. You have a condition at home, you want to come to the emergency room, we are there. Full service, lab, radiology, all of the things that you're used to today will not be any different come October 1st.
And if you have to get admitted, you get taken to whichever one of the two hospitals you need to go to?
Exactly. And, people don't always realize that in any community emergency facility, there are times that you will be transported to a different facility. Every hospital has different capabilities. Sometimes you need the really advanced services of some of our academic partners in Boston. And so there could be times you come to an emergency facility and you're transported there, or transported to another facility in the region that has services that are only available in a few locations. So it happens today that in any emergency facility you get transported to other facilities sometimes. So yes, if you come in, you need inpatient care, and we have that care in Methuen or Lawrence, we will transport you there.
So about the testing instruments, you have the X-ray machines and all that?
Yes, all the same. So if you have an emergency, we have the right teams and the right equipment there. In fact, we've actually been investing a lot in our emergency facility over the last several weeks and months. It was in a little bit of disrepair from the previous owners. So we have been doing a lot of repair and refresh, everything from new windows to paint to new equipment to creating new clinical space. And we're going to continue that work in Haverhill.
All right, and now, I've never had to be at the hospital, as an inpatient person, but the surgical beds, is that what you were calling them? They were upstairs?
They were upstairs, really not so much surgical. So the kind of term in medical lingo is med-surg beds, and that really is just distinguishing from, say, maternity beds or from behavioral health beds. It doesn't necessarily mean you had surgery or surgical. It means that you're there for some sort of an acute medical condition. Most of the patients who are admitted with Haverhill have either some sort of cardiac condition, respiratory condition, more minor conditions that do require inpatient care for a few days, but typically not as acute as needing ICU support or surgery or ORs, that kind of thing.
I've heard I've heard stories about perhaps this would be nearer to my heart, a sleep lab up there.
Yes, in fact, so one thing we've already done is we've put in new hyperbaric chambers and really expanded our wound care service there. And the next service we're looking at, there is a small sleep center there in Haverhill now, but we have the opportunity to really make it a showcase for our system and make it a much larger system-based sleep center that provides all services. So we are going through that process now.
So if you had a sleep center there, then you wouldn't need to have one in Lawrence or Methuen, right?
Yeah, so one of the advantages of now being Merrimack Health and having a system is that we can create larger kind of centers where we can have the most excellent high-end care because there's enough volume, but you don't necessarily need it at every facility. So there will be some services that are only available in Haverhill. There will be some services only available in Lawrence, some only available in Methuen. There will also be some services that are available at all three. So for example, the emergency facility, we will have in all three sites because it's needed by the community. But for cardiac caths, for example, or trauma services, we currently provide those for the region at Lawrence Hospital. So it really gives us a chance as Merrimack Health to think about where do we have those services. So yes, Sleep Center could potentially be the sole showpiece for sleep services in Haverhill.
Do you have to get a state license for that?
Yeah, almost everything we do in healthcare requires some sort of state licensure. So yes, we would work with our partners at the state to make sure that we have the appropriate license and space and go through all of the regulatory processes that you need to do. It's never a super quick process because of that, but it makes sure that we have the best and safest care for our patients.
Now, are you thinking of any other services at the Haverhill campus?
Yeah, the great thing, Haverhill space is beautiful. It needs some refurbishing, but it's really beautiful space. So we really want to partner with the community about what other healthcare services are needed in the area. Those could be services we provide, could be services that we partner with another healthcare provider to provide. So more to come on that, but our expectation is that that remains really a vibrant key part of our system, providing healthcare to Haverhill.
Now, is the bariatric chamber? I know that some hospitals they would rent out the space to people with the chamber. Is that kind of what's happening in Haverhill?
Yeah, so the hyperbaric chamber, we actually partner with a kind of specialist in that area. So the services are provided by our clinicians, our physicians are kind of running that service. But because we don't have a lot of experts in hyperbaric chambers that are specific to our system, we do partner with the service to do that. And so when I talk about other services we might have in that location, we could potentially see the same sort of model where we're providing the clinical oversight and the clinical care, but we're partnering with someone who is more expert in either the equipment or the particular types of services that we're providing.
X-rays like mammograms and things like that?
So we have X-rays and radiology right there now, and that will continue. Mammography is actually a need, and we are looking at expanding mammography services in all of our locations, not just Haverhill. It is a need in the community, and there is sometimes a challenge getting access anywhere in the community for those services. So that's one we're likely to expand. But your kind of what I'll call routine X-ray services and imaging services, those are at Haverhill today, and those will remain at Haverhill.
All right. Well, Diane, is there anything else that you would like to add, or any contact information if people had thoughts that they want to relay to you?
Yeah, so we have a website, actually our new website, merrimackhealth.org. So although you can find us at our old websites too, there is a lot of information on there, both about what the Merrimack Health brand means for our communities, but very specific information relative to the changes at Haverhill, what's coming, what to expect, and also a way to send us questions or give us feedback right on that page. So please, if you have questions, reach out to us. Know that we are here for certainly Haverhill, but also the entire eastern Merrimack Valley. That's why we're now Merrimack Health, so we'll be here for the community.
Is it spelled out, Merrimack Health?
It is.
Okay.
Yes.
All right.
Yeah.
All right, so Merrimack Health Lawrence, Merrimack Health Methuen, Merrimack Health Haverhill.
Exactly right.
All right, and it's Diana Richardson.
Yes. Yes, Diana Richardson, interim CEO and president at Merrimack Health. Delighted to be with you this morning.
Well, thank you very much, and hopefully we can get you back again.
Great. Thanks so much, Wynn.
All right. It is The Wave, 97.9 WHAV.
Wake up with Wynn Damon weekdays from 6 to 9 a.m. on 97.9 FM WHAV.